My employer just said their healthcare costs are out of control and we need to fix this. Yes, that's correct. They just told us we, as employees, need to work hard to make sure the company healthcare costs are going down. Or else it will impact our bonus and/or will cost jobs. They also referenced a WSJ article, which I assume is this, but I can't read that one. Suggestions on the slide. Don't go to the go to urgent care. Prioritize telehealth over in-person visits. Use generics over name brands. Talk to our physicians to reduce price or find alternatives. Use mail order instead of going to the pharmacist. Call manufacturers to reduce price. Make sure you really need the medication. Amazing that small business owners are not the loudest voices for universal healthcare. Small businesses get creamed on rates, and yet it is never the fault of the pro-business and anti-healthcare politicians or the greedy insurance companies, but the employees themselves that need to get slimmer, use less medication, and stop having those pesky kids that cost so much money to birth and rear. Decoupling healthcare from employment will have a profound effect on the employer-employee relationship. Next, they're gonna do 1-1 or a company survey with medical questions to help isolate the financial risk of certain medical policies, insurance policies. Or if you have a call-in or need to leave for an APPTime, they'll give you grief. If so, I can appreciate where you're standing. However, any decisions about my medical needs will be determined by my medical team, and frankly, not only is it inappropriate to even suggest this, it could be considered discrimination to specific individuals with specific medical conditions or needs. I suggest you tread lightly. For me, moving forward, my medical needs are not up for discussion. The telehealth one made me laugh. They hate offering telework but prefer you use telework when it's someone else's business. My employer switched to a new coverage plan for prescription meds to save money. Any prescription approved by insurance is now mail-ordered from Canada. Absolutely mind-blowing that the cheapest way to get healthcare in the US is to buy it from Canada. Ask them how they plan to do their part and advocate for affordable healthcare that is not tied to employment. How large is your company? Are they self-funding their insurance? They're the ones who have been lobbying for decades to tie healthcare to employment as a way to control their workers. Now they're just realizing it's expensive? Fuck 'em. Interesting that they don't have an item that says write your senator and representative to support Medicare for all and universal healthcare. The fact they didn't mention it tells us that they want to keep employees trapped in employment with employer-provided healthcare. Tell them in the most polite manner to ingest excrement and kindly shuffle off this mortal coil. Why is your healthcare any business of your employer? What country are you in where healthcare is tied to employment? It sounds like an absolutely inhumane system. Healthcare plans already incentivize these behaviors by e.g. charging less for generics and telehealth. If your company is having trouble with their HC choice, they can choose a different provider. If they need to save more money, it can likely come from the bloated salaries and bonuses of upper management. Fuck them. Now that you know their priorities are to lower your quality of life, you should probably act accordingly by creating less value for them or leaving. You know what would really help me to be healthy and reduce doctor visits? A 4-day, 20-hour work week. It's called universal healthcare. That would make it cheaper because then businesses wouldn't be burdened with these costs. Tell everyone at your Republican conferences that UHC would be good for business. Forgot the biggest cost savings vote for national healthcare. so their costs will drop. Even with the increase in taxes, it will still be lower than their total spend. So is the company introducing any kind of wellness programs or practices? Or encouraging workers to vote for politicians that support affordable healthcare? Have y'all tried just dying instead of getting sick? I heard it could really cut down on costs. Why aren't they lobbying hard for universal healthcare? That way it won't be their problem anymore. Asshats. Sounds like Murica D. Every day that pass we are bombarded by slavery. Ah, America. We're so awesome, aren't we? Universal healthcare benefits business and everyone scream it from the rooftops. Canadian here. Just tell them to pack up shop and move to Canada where they don't have to pay for any of that. I'm only joking. But this is the angle that the American left should be taking to get single-payer healthcare passed. In the US, it's the only way I ever see it happening. Tying your job to your healthcare is exactly how companies control their employees and can treat them like crap. They can't leave. This is not an issue here in Canada. I can tell my boss to F off and not have to worry about little Jimmy's heart condition. Some of those are good ideas that should have been presented in a different way. My friend's company dropped their insurance after 2 workers had premature babies. That's how that shit company solved it. I would be posting all about how to make universal healthcare a reality all over that business. You see, I'm a team player and just want to help. Start putting Bernie Sanders for president posters throughout the building. Ones that promote Medicare for all. Removing healthcare from the employer will lead to big savings. Besides their contribution to the insurance company, they also save money on having to process employee claims. Make sure you really need the medication. LMAO. They can fuck the fuck off. I pay $1,400 a month in insurance. I am going to go to the hospital if I have a hangnail. My ex-employer played musical chairs with our health providers. Once the discount ran out after 2 years, they'd switch to another equally garbage coverage provider. Business just die already. I saw this title and in my naivety I thought you were gonna say preventative things like better work-life balance, yoga or stretching or taking walks, eating more healthy. Even better. I worked for a mid-sized company and there was a meeting about healthcare costs and the president of the company basically blamed the rising cost on 3 employees who had cancer treatments. We all knew who the 3 people were, but it was awkward and absolutely unnecessary to point out those poor individuals. It always amazes me the number of people that bitch about the possibility of having to pay for universal healthcare out of pay but then turn around and most likely pay more to a health insurance company for private insurance. It's so weird to see this kind of crap. From the UK we often feel so close to the US on many fronts, but healthcare is mental. My mom's dying from cancer and since November she has had what would be into the millions of dollars. Inflated US prices in care and support to get her to this point. Even now she's sat in hospice getting the best attention and care and meds can provide. I don't see how people can deal with this situation with bean counters sending you invoices for hundreds of thousands. Tell them to stop voting Republican and vote for Democrats who support universal health care. Why is my healthcare tied to my employer at all? The whole model is asinine. Step 1: Find a job in another industrialized nation that has normal healthcare. Step 2: Move to the new country. Step 3: Become a landed immigrant permanent resident. Step 4: Something about cookies? Or maybe banana bread with dark chocolate chunks in it.